Alhamdulillah, wassalatu wassalamu ala Sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. Amma ba'd. The Kenya Association of Muslim Medical Professionals in this country, we have sat together and we have agreed that we have to take a role now in advising the Muslim community about the coronavirus and what, from the Islamic perspective, we should do. We have been contemplating to do this a few days ago, but Alhamdulillah, today it was announced that there is now a case of corona in Kenya. Corona, the current corona, is a new virus. Corona has existed a few years ago. We used to have the SARS, the Middle East Respiratory Syndrome. All these are families of corona. But the current corona is a mutant. It's a virus that has changed from animals and is now affecting human beings. And the epicenter of this virus is in China. It is not good for us to contemplate why God decided it to be in China. All the reasons, we leave them to Allah subhanahu wa ta'ala. Whether the Chinese punished Muslims or something, that should not be our responsibility to decide. However, we know the Chinese have a habit of eating everything. And it is possible that it might have happened because of that. Long time ago, in 1981, we closed Nairobi hospital because there was also another person who used to have a very nasty habit of doing sex in Mount Elgon. And he got what at that time was known as the green monkey disease, the Marburg. Now we have the corona, a very contagious disease, very infectious. A case has been reported in Kenya. It is possible that we will have many cases coming forward. But as the Sheikh has said, the first step that we should have as Muslims is to rely on Allah subhanahu wa ta'ala, that Allah is in control. So that's the first thing. The second thing is we are no longer relying on the epicenter. We are no longer saying it is from China. Now it is coming from all directions. It's coming from states, it's coming from India, it's coming from Iran, it's coming from all over. The best thing we can do as Muslims is to do preventive measures. And one of the things that we do is, first of all, by exclusion, if we get any kind of flu or fever, we must exclude corona. In other words, we must be on the lookout on how best to exclude the possibility of exposure. If we find a suspicious case within our families, we must accept and we must isolate that person. So people should not feel bad to be secluded from the society. Just like the Sheikh has said, that we need to do isolation or self-quarantine, as it is now referred to. Secondly, we must seek medical care for any illnesses that we have in our homes. And we know this corona is transmitted through contact or through discharges from the body. And therefore, our standard of hygiene should be at the top notch. And I want to demonstrate very briefly how the virus survives in our hands and how best to wash our hands. Normally, as Muslims, we say we have come from the mosque, we have taken wudu. So when we go to eat, we wash the tips of our finger. That has to change. The virus lodges itself on our hands and in between our fingers and under the nails. And therefore, the washing of the hands shall be a bit more thorough than before. We have to destabilize, when we are washing our hands, we have to destabilize the bacteria and the viruses in our hands by using the soap and the water oozing, and we destabilize them first. Secondly, after doing that, we have to also wash between the fingers. You put one hand to go through the fingers in one direction, and then the other hand to go in the other direction. The top side of our hands, we never wash them, but it is possible that the viruses can also last there. So you must also wash the top of your hands, both sides. Under the nails, you must wash your hands again. And when you do that, you will notice that the thumb has been left out. It must be washed separately. Both the hands, and then the wrist. Some of the viruses could also be on the wrist. So we must wash the wrist. When we sneeze, we release many bacteria and viruses. The best way, and the Prophet, I'm told in one of the sessions here by one of the chefs, is that he used to cover his mouth. We encourage that you don't sneeze in your hands. Sneeze in your elbow so that you can cover that and you don't transmit it to other people. So that's in the hygienic area. Wash yourself as many times as possible. The sunnah of washing our nose when we are taking wudu is normally forgotten and left. We need to start adapting that a little more now. And then when we have a patient, try to keep him away. Reduce the travels. Reduce traveling excessively from one place to the other. We will be assessing this situation. In Britain and the US, they are now working towards the vaccine development. They have already identified the genetic structure. They have already found the diagnostic kit that can very quickly determine. We hope that this vaccine will come very soon. The other issue is to make sure that in our homes we have at least the medication necessary, the sanitizers and other items, and the masks, at least to use in the houses. In case of shortage of these masks, you can even use a cloth, because this virus is a bit big. It cannot penetrate the cloth, the ordinary cloth. So we need to do that. And then disposal of these clothes is very important. We must have concurrent disinfection. Even our normal jik and the others are good enough for that purpose. And inshallah, we keep on praying all the time, and we'll keep on briefing the Muslim community on that situation as the situation develops, and we will try to do our best to make sure that we are well protected, and the best thing is to rely on Allah and pray to Allah subhanahu wa ta'ala that He keeps us safe. Finally, as the Sheikh has said, in one of the hadiths of the Prophet, he said, in such an outbreak, it's a Rahma to the Muslims. If you get it, if you are afflicted, and you trust in Allah, and you accept it from Allah, you get the ajr of a shaheed. Inshallah, we ask Allah not to give us that test, but if it comes, we need to accept. Wassalamu alaikum wa rahmatullahi wa barakatuh.